Let me read out the title and the speaker for the pre recorded talk. Community Participatory Mapping of Water Sanitation and Hygiene Access for Sustainable Urban Planning. Community Participatory Mapping of Water Sanitation and Hygiene Access for Sustainable Urban Planning is the Judith.
Hi everyone. I hope you all so far have enjoyed State of the Map 2025. It's finally almost coming to an end, and I hope we have learned a lot from this year's State of the Map. Those who are in Manila, I hope you're having fun and enjoying. My name is Esther Judith Otieno from Nairobi, Kenya, working at African Population and Health Research Center. In this organization, we do work or research work that aims to generate evidence and capacity strengthening of the research sector in sub-Saharan Africa, with an aim to improve population and public health and general population development. So, under the organization, we have a unit called Population Dynamics and Urbanization, where we did work on community participatory mapping of water, sanitation, and hygiene access, with an aim to have sustainable urban planning within our urban sector. So part of the team is Francis Onyambu and Caleb Cheruiyot, and I'll be representing the work that we did. I am a geospatial data and remote sensing analyst, and I currently do work related to spatial data analysis and also Earth observation. Today I'll be presenting work that we did with an aim of exploring geographical location and inequalities in access to water and sanitation in informal areas. These are Korogocho and Viwandani that are in Nairobi. We aimed to promote open data source availability, not only for the community members, but also for the leaders who use this data to bring improvements to the community. So our community-driven approach was to involve the local residents and the community leaders to participate in identifying the wash assets within their community. But during this exercise, we were able to do more than just that, and we were able to also explore the different assets that they have within their community that are not yet mapped. So the initial process was providing them with maps to ensure that do these people first even know how to use a map. So through this, we knew where their skills are at and where we can start from. So from this, they were able to also note some of the facilities or some of the assets that they had within their community, and they were able to do this on physical maps. So we told them, okay, now this is part of also mapping. And other than this mapping, we can now go to the field and also collect data on the same things that you have mapped on the physical copies of maps. So we trained them now on data collection. We used SurveyCTO to train them on data collection, and they did data collection, and they were able to collect a total of 940 amenities that are not only including water points, toilets, and garbages. We had a focus on wash but we then expanded to even more facilities that included clinics, hospitals, education facilities that they had, the different markets within the communities, and we were able to now collect data on this. So after data collection, we now came to the office and now told them now we need to process this data. So we trained them on using QGIS as a simple and open source tool that they could be able to georeference the data, upload the data, visualize the data, and also clean the data. So we used different tools for cleaning. For some of them, they had a brief knowledge of Excel. So we started on Excel, did some cleaning on that, then advanced to QGIS. And after data cleaning, we uploaded the data onto Java OpenStreetMap. We used JOSM to now upload data onto OSM. And through this cleaning process, they were able to learn, and they were quite interested. We used the OSM tagging scheme to do this, and we described the amenities. We told them how they can explore the OSM tools that have been provided, the vast documentation that they can also read into to know how this data is going to be used. The leaders were also involved, and they knew that okay, now we can use OSM. It's open source, we can download it. They even checked it on their phones. Now, after doing the validation, going to your phone and checking, okay, yeah, now we have some data on our community within OSM, and I can even share it with other government officials to see, okay, we have water point here, but this whole place is not accessible to water points. And we were able to upload this data on SM, and now the communities are now rich in data. Apart from being rich in data, they also have now the skill that they can train other people on, or they can use this skill on other areas also. So as you can see, these are some of the facilities that we uploaded. Not only the wash facilities that we previously had interest in, but they are more than that. And they felt like having this, since you're already collecting the data, what about we just collect all the data that are useful, or are maybe even landmarks for other people to know that this is our community. So we had a focus on WASH, and we were able to help in improving service delivery, strengthen planning, because the leaders were also involved in this, and also empowering the communities and doing capacity strengthening of the community members. This enhanced resilience, and we were able to see the youths within the community coming in and initiating cleaning of the community in general. From this, we were able to create idea maps, that ecosystem platform that they're able to use, not only with regards to availability of data, but this data can be analyzed and models to visualize other things, other broader things, rather than just seeing the data. So this platform was aimed to provide the different, or it had a focus on the deprivation levels of the communities. So what are the deprivation levels of this community that you're working with? So we extracted data from OSM, and were able to create this model that can be able to model the deprivation levels of the community. This model is currently in Kenya and also in Nigeria, and we hope to be able to expand it more to even other areas. You can explore our model at the link I have provided, and also continue doing the work in other communities. We have other prospects of, we want to expand this to even other cities within the country that can also help in continuing to map and provide open data for the leaders. So we noted that the power of participatory mapping reveals even different challenges. Our focus was first on WASH, but we realized that also health is a key issue that also needs to be mapped. There was open data sharing advances, and there are also community led solutions, and these solutions matter not only to the leaders but also to the community members. So that was part of the work that we did, and I'm glad to be able to present this to everyone else. And this is something that is quite replicable. So as long as you have the people that you'd want to train, training them, and them having the simple tools that they can use to collect data. Some of them even noted we can use our phones to collect theirs. They were able to volunteer as much as we had provision for that. But this was a good initiative, and we hope to advance this to other cities in Kenya and also in Nigeria. So I'm glad to be presenting today. And just in case of any questions, I'll be ready and free to answer. You can find me on the email I have there on the screen, and also my contact. So have a good time. And as State of the Map Manila 2025 ends, bye everyone.